Welcome to Education Learning Academy. In this session, we will learn about the role of the SENCO. A special educational needs coordinator is very important in a setting because they help make sure that children with special educational needs get the right support. They lead the setting's SEN provision and make sure that each child's individual needs are understood and met. Let's look at their main responsibilities. In early years settings, the Special Educational Needs Coordinator, SENCO, is a legal requirement in all maintained nursery schools. They support very young children who may have additional needs or developmental delays by focusing on early identification and early support. They observe how children play, communicate, move, and learn to spot any signs that extra help may be needed. The SENCO creates simple support plans with activities to develop skills such as speech, movement, and social interaction, and guides nursery practitioners on how to help the child during everyday routines and play. They also work closely with parents to share ideas for support at home and may involve professionals such as speech therapists or health visitors if needed. Their main aim is to make sure every child feels included, safe, and able to take part in nursery activities. According to the Children and Families Act 2014, the Special Educational Needs Coordinator coordinates support and ensures children get the help they need to access learning and make progress. The SEN Code of Practice explains that the SENCO is responsible for overseeing and improving this support, working closely with practitioners, parents, and outside professionals to create tailored plans for each child. In early years settings, the Early Years Foundation stage states that the SENCO helps identify children who need extra help and ensures they receive the right support so they can develop skills. A special educational needs coordinator works with many different people to make sure children with additional needs get the right support. In the nursery, they work closely with the nursery manager to make sure SEND policies are followed and that there are enough resources. They also support key workers and early years practitioners to plan and review activities so that activities are accessible to all children. If there are any welfare concerns, they work with the safeguarding lead. SENCOs also work with outside professionals, including services from the National Health Service, such as speech and language therapists, occupational therapists, and physiotherapists, as well as educational psychologists, health visitors, pediatricians, specialist teachers, and sometimes social workers. They also communicate with the local authority SEND team and EHCP coordinators. The SENCO makes sure everyone shares information, sets clear targets, and follows a step-by-step process of assess, plan, do, and review so that each child receives consistent and effective support. SENCOs build strong partnerships with parents and carers to share information, set targets, review progress, and ensure consistency between home and nursery. When collaborating with outside agencies, several issues can sometimes occur. One common problem is poor communication. Information might not be shared clearly or quickly enough between the nursery and professionals, which can delay support for the child. There can also be long waiting times, especially for services from the National Health Service, NHS, meaning children may wait months for assessments or therapy. Another issue is different professional opinions. Teachers, parents, and specialists may not always agree on what support a child needs, which can cause confusion or tension. There may also be confidentiality concerns, where information cannot be shared fully without parental consent. In addition, agencies often have limited funding and resources, which can reduce how much support they are able to offer. Scheduling meetings can also be difficult because professionals have busy timetables. Taking all of these challenges into account, it is still vitally important to collaborate with outside agencies because working together ensures that children receive the most effective, well-rounded, and consistent support possible. A SENCO must keep clear and accurate records to make sure children with additional needs get the right support. These records include health and care plans, EHCPs, An EHCP is a legal document for children and young people aged 0 to 25 years of age who need more support than a nursery or school can normally provide. It explains the child's special educational needs, the support they must receive, and the goals they are working towards. Because it is a legal document, the support written in it must be provided. SENCOs also keep individual support plans or SENAN support plans, documents that show the assess plan do review process, including targets and progress. In addition, they record observations, assessment results, reports from outside professionals, notes from meetings with parents and other agencies, referral forms, correspondence, and parental consent forms. They may also keep behavior or incident records and safeguarding records, which are stored securely and separately. All information must be kept confidential and follow data protection laws to ensure each child receives consistent and effective support. It is also important that SENCOs support staff CPD continuing professional development because it helps ensure that all staff have the knowledge and skills to meet the needs of children with special educational needs and disabilities. When staff receive regular training, they feel more confident in adapting activities, managing behavior positively, and using the correct strategies to support individual children. This leads to better outcomes for children as support is consistent and effective across the whole setting. CPD also keeps staff updated on current policies, legislation, and best practice, helping the nursery remain inclusive and meet legal requirements. Overall, when a SENCO supports staff training and development, it improves the quality of teaching and care for every child. If you want to become a special educational needs coordinator, you first need experience working with children, usually in a school or childcare setting, and relevant qualifications like a Level 3 Early Years Diploma or Early Years Educator Apprenticeship. You will also need to complete a SENCO training course, most commonly the National Award for Special Educational Needs Coordination, NACENSO, which usually takes about a year part-time while you are working. You will need to develop knowledge and skills in supporting children who have special educational needs, understanding the laws, and continue with professional development to stay up to date. If you would like more information about the Special Educational Needs Coordinator role, you can speak to your Education or Learning Academy coach. You can also talk to the SENCO in your setting to gain a better understanding of the responsibilities involved. Why not ask to shadow them? If you are completing an apprenticeship, this can provide valuable insight into the role and would count towards your off-the-job training hours, while also developing your knowledge and experience in supporting children with special educational needs.